Hi, this is Dr. Sive Gallagher, and today I'm very lucky to be joined by Dr. Juan Carlos Venus, who is a board certified family doctor who has special expertise in gender confirmation medicine. So he's going to answer some of my questions today to help you guys understand a little bit more about medical transitioning. And so we're going to start, this video is for our female to male patients. We're going to talk about masculinizing hormones. So we're going to start with a very basic question just to get going. So Dr. Venus, how do I get on hormones?
All right, I wish it was as easy as it sounds getting on hormones, but we know there's a lot of barriers you often face as a patient trying to get the care you need. There's not a lot of requirements medically or going through mental health evaluations and stuff like there used to be in the past. We've changed and we use a model called informed consent, and I know that a lot of my patients know what this means. And basically what this means is that your provider gives you all the information you need to know about the risks and the benefits of hormone treatment so that you can make the decision for yourself about seeking medical confirmation through hormones or cross-sex hormones, like doctors typically refer to it as. It can be hard to get into a clinic, to get an appointment, so there's a lot of valuable resources out there on the internet to try and locate a clinic near you. But once you set up an appointment, and a lot of clinics are going to want to talk to you a little bit about your experience of gender and your gender identity to really confirm that you deal with dysphoria. So there is that story, but we are also very aware today that every person's experience of dysphoria is different, and we don't have that same kind of gatekeeping that happened in the past where people had to maybe live for so long or present a certain way in order to be prescribed hormones. So I never want my patients to think that they have to give me a certain kind of packaged answer or whatever to get access to this kind of treatment. And So,
and how about age-wise? Can you be too young for hormones, too old for hormones?
Excellent question. So I have less expertise in the treatment of pediatric patients or adolescents, but I do have patients who are 16 years old. And kind of at this age is when I know that my patients have the ability to make a decision that's have the ability to give informed consent, but legally they have to have a parent or guardian willing to consent. Right. So in these patients, though, who have gone through puberty of their assigned sex at birth, typically it's not hard to start gender-affirming hormones in them, but you obviously have that barrier of getting your family on board.
Right, they have to consent. And how about too old? Is there such a thing as too old for testosterone?
No, that's a great question. This is something that's not super well understood, and we're doing more research on this, but a lot of patients start masculinizing therapy at different parts of their life as they're going through their transition, and there's not really any time that we have to stop doing it. We have to consider medical risks, just like at any age, but we give you all the information and try to help you optimize your general health, to make sure that it's safe and use the appropriate dose and the kind. But for masculinizing hormones, there are less risks than with feminizing hormones.
Okay. Awesome. All right, thank you.